Hello and welcome to the Hospital Management Asia webinar session. The session today is entitled 3 Keys to Unlock Your Healthcare Team's Potential. Today's session will be presented by Mr. Michael Podolinsky. He's been awarded the CSP Global title only held by select few. He is Asia's productivity guru, author of 15 books on productivity, including his McGraw-Hill Productivity series. He's helped over 700 companies in 36 countries to unlock their team's productivity and tap into their potentials. He's also worked with NUH, SGH in Singapore, SQUH in Oman, the Sultan Qaboos University Hospital, the Fairbank Memorial Hospital, and also Mayo Clinic. Just a quick reminder, if you have questions, you can type it in the chat box on the left side of the dashboard on your screen. Mr. Podolinsky will answer your questions at the end of the presentation. And now, to start the session, please welcome Mr. Michael Podolinsky.
Well, thank you, Rose. I really appreciate that. And it's an honor to be here sharing my passion with you, productivity. And today what we'd like to do is cover 3 keys to unlock your healthcare professional team's potential. That's what we cost our organization. And a lot of people are shocked by that. They think, well, no, my salary is the highest part, but it's not. Healthcare, as far as an insurance policy, costs in Singapore, for example, about $10,000 on average. There's training time to attend webinars like this that you're getting paid for while you're sitting there learning at the hospital expense. You're also going to other meetings, and the meetings aren't necessarily that as much of a productive use of your time. You're going to find that you are involved in all kinds of different activities. You take up space that costs money and so forth. So it's literally only at 248% of your salary do we start to become productive. And we need to get this idea across, not only for us, so we value our time, but also for everybody on our team, asking them, are you truly being productive? And a lot of people don't get that, and as a result, they don't feel the need to work, or they see the hospital having so much money, and they don't think of it as stealing from the hospital, yet that's exactly what they're doing if they don't give their very best. So we need to start getting our people to understand productivity, that it's value add, and ask them, what is the value add that you bring here? Are you just doing a job and one job gets replaced by another job, or are you really adding value to what you're doing? Starting off, our first key is talking about productivity systems. Not leaving it to chance, but actually coming up with systems that'll help us improve productivity. Question, have you ever been on a vacation before? And if you have been on a vacation before, how much work did you get done the week before your holiday? Statistically, most people do twice as much the week before a holiday as any other week. Twice, double. Why? Well, normally you come into the office, you're working, you have a sip of coffee, somebody stops in, a little chit chat, and then you finally get into your working routine. There's interruptions back and forth, and we let people interrupt us from doing what we need to do on a regular basis. Now, if somebody's in the accident emergency room, I mean, there's a difference there. You're going to have interruptions, but for many of the vaccine jobs and so forth, we should be able to control those interruptions. And the week before holiday, you can't leave. You cannot leave until you clear your desk off and clear the desktop off your computer. So people come in and they want to chit chat. No, I gotta go. We end up working a lot, getting a lot done, instead of letting other people rob us and steal us of our time and our productivity. We put a wall up in front of us. Don't come here because I have to leave on holiday on Saturday and the tickets are paid for and I gotta clear everything off first. In other words, we set our lives and our time as a priority. So question, if you can do that the week before holiday, why not every week? Well, I get stressed out. No, actually, you would have less stress because you're finally taking responsibility for your own time and your own productivity instead of blaming everybody else and all the interruptions and everything else. We need to control our interruptions or they will control us. True or true? Choose any one, and it's a pretty good answer. The reality is we need to teach our people that if they could do this before their holiday, before their vacation, they should be able to do it every week, and start getting people into the mode of stop letting people interrupt you for things that are not relevant to your job and what you're supposed to be doing right at this moment in time. Second, emails. They take up anywhere in the organization between 15% to 62% of our time. Wow, that's a lot. So question, can you ban emails? Atos, French firm, a rather sizable 12 billion euros firm, found that only 10% of their emails were actually useful. Most of the rest were useless. They were a waste of time. So they just simply banned internal emails. And they found, first of all, they saved 25% of the time that they were spending on emails. And they got a lot more done in the process. And it forced people to start to, oh, I know this is a shock, but had to go and call each other, talk to each other, walk over, greet each other, which helped to also build connections. They've found a 30% surge in customer satisfaction. And in hospitals, translate that to patient satisfaction, internal team satisfaction, and also the efficiency of everybody operating. So consider a system whereby you ban internal email. Say, let's stop doing this. Let's stop wasting our time. We got email without even thinking how we use it and how productive it actually is. Fast Company reported that those that are not banning internal email are also will be banning or for a day or for half a day in emails from the outside. And what you're saying is no email once a week or only half a day during the day as we go through the week. Interesting. When you look at organizations that have banned, like U.S. Cellular, 67,000 employees, $4 billion company, banned emails on Friday, and 27, they said relationships improved. One of my favorite examples from U.S. Cellular, this guy had been struggling months, going back and forth, back and forth, back and forth, trying to get an answer from somebody and work out an arrangement. No email Friday was on, so okay, I guess I can't email him again, so did something strange, picked up the phone and called this individual. In talking with him, he said, hey, you know, your phone looks very similar to mine. What city are you in? I told him what city. They were in the same city. What building? Same building. What floor? Same floor. He said, I'll meet you by the lifts in 5 minutes. They walked over to the lift, shook hands, settled it in 5 minutes. Months of bantering back and forth, wasted. 5 minutes face-to-face, got it settled. It's a great way of making yourselves more productive in the process. Banning emails on Fridays in 2006, one of the first firms to ever do that was PVD, a logistics firm. And people go home with a clean inbox, and they just found it worked, in their terms, ridiculously well. If you want a 20 to 25% productivity increase, consider replacing email altogether with internal social media boards. Have you ever had somebody say, I did not get that email? And they probably did, but it went to spam hell, or they missed it, deleted it accidentally, or maybe they just didn't want to do it and thought nobody would bring it up again. If you have a private Facebook page, an internal social media page for your organization on your intranet, you go and put in the information for that team or that project, and you always put the most current information on top, and the other older information gets scrolled down. And in the process, anybody who comes new on board can go and scroll back and see how we got into this position, how we created these procedures, why we created these procedures, as opposed to having to interrupt people and asking and so forth. This way, you have a written record of everything you've done on a project, everything you've done for the department, everything you've done to make the hospital safer. It's all there in your internal social media board. And by the way, this is like IBM made their fortune on whiteboards in their offices long before everything they did in the office was online. And they would just have whiteboards. People would scribble something on. Can you help me with this? Hey, how would you deal with that? And people would write in answers. And as they walked around, they would learn from these whiteboards. And eventually, when the board got full, erasing what was older data and putting something new up, a new question. And this is essentially taking the whiteboard concept, putting it into an electronic board, and it makes us incredibly productive. Cut the skiving. In Singapore alone, and most first world countries, people skive 90 minutes a day. 90 minutes a day. Skiving is no leather working term, of cutting off the excess leather. And what they're doing is they do personal email, personal social media, personal web surfing, personal shopping, personal phone calls, personal. 90 minutes a day. This is an expensive habit. You got to ask them when you come to work. Then go home on time and have a life. I know it's kind of scary, but there is life after work. It does exist. So we need to make sure we're availing ourselves of it and using it, being as productive as possible. If you look at the 90 minutes a day, it's a simple thing to start to do, is to block out 90 minutes a day, that 90 minutes, so it's not being wasted, it's not being thrown away, it's not being skived, but to focus on that 90 minutes and to get the most out of that time, if at all possible. 90 minutes a day, what does it add up to be? Well, 18 weeks a year, if business day weeks, and that's 4.5 months lost due to skiving. So just imagine if people didn't skive, you could literally shut down for more than 1/4 of your year and get the same amount of work done. Does that strike you as being a bit odd and a huge waste? It is. What we need to do is stop skiving, get our people not to skive, not to waste time on social. Do your social stuff at home, do your personal stuff at home. Now, one thing, Gen Y has a propensity to want to do social while they're at work and interact back and forth. And that's okay as long as they do not mind working late. Many of them live with parents, and they'd rather be at work sometimes than at home with their parents, and that's understandable. So it may be okay for them, but if you want to leave on time, tell people, if you want to leave on time, stop skiving so you can get more done during the day. And if you do work late because you want to do your skiving during the day, don't complain about longer hours. We waste times with smartphones. Smartphones, there are, since 2015, there are more phones in the world than human beings. And our phones have taken over our lives. We got the phones and nobody really thought about how it takes away productivity. We only think about how it adds productivity. In the US alone, it's $5,258 per employee, according to CFO Daily. That's a lot of waste of what it's costing your hospital, costing your clinic. So you want to make sure that you don't leave your phone on during the day. Yes, use it at lunchtime, use it on your breaks, that's fine, but 16.5% statistically leave their phone on their desk or on their tabletop at their station, and whenever there's a vibration, they stop and check it. Many times missing some key ideas or forgetting things that they wanted to do, and the key idea becomes lost. Second key, the 90-minute marvel or 25-minute multiplier. These are some amazing tools you can use to control productivity and to boost it within your teams. 90-minute marvel, life-changing. Studies have shown that we sleep in 90-minute cycles, and that we tend to have the most productive block of time is 90 minutes when we are working on an A1 project, a major project. It doesn't matter so much if you're clearing away your C's, your incidental things, cleaning up your desk. You could do that for a while and jump to something else, jump to a phone call back and forth. But we cannot multitask. That's a myth. People cannot multitask. Multitasking is a myth. You need your full brain power to concentrate on an A1 project. And it's like switching on a computer. When you turn on your computer, you can't type instantly. You find that you first have to have the OS boot up, and then your program has to boot up, and finally you can start to type and work. Well, the brain is the same way. It takes 13 minutes on average on an A1 project. You got to think about budgets, who's going to be involved, all the other material requisite to that project. And now finally, after 13 minutes, you're working productively. 14, 15, 18 minutes, 19 minutes, there's a knock on the door. What, huh? The brain freezes up, just like a computer hard drive. What, oh, you want to go to lunch? Sure, we can go to lunch. When do you want to go? I don't know when you want to go. I don't know when you want to go. It's only a 1 minute interruption, but that one key nugget, that great idea you just had, gone into the ether. We lose it. 90 minutes uninterrupted is the most productive time block you can have. And if you can do that, you can be incredibly productive. Take a little break, go back to another 90-minute block and take a little break, and back and forth. You're going to find you will get so much more done. If you make it a team-wide productivity block of 90 minutes or a hospital-wide 90-minute where we don't interrupt each other as much as possible, you could get a 30% boost in productivity straight across the board. So it's 90 minutes, 20-minute break, 90 minutes, 20-minute break, back and forth, and you find you'll be a lot more productive as a result. Friend of mine, Chris Kelway with IBM, he made it into the golden circle. Out of 400,000 employees at IBM, he was in the top 400. He sold the single biggest piece of business that IBM has ever had in its history. And he said, look, I met this guy 20 years ago, and he said, this really works, and I've practiced it ever since we met over 20 years ago. So don't take my word for it. You can take his. The 25-minute multiplier, sometimes referred to as the Pomodoro effect. Some people can't work that long. They got obsessive compulsive disorder, or they got ADHD, or they got something else that's it makes it frustrating for them. They need shorter blocks. Then 25 minutes short break, 25 minutes short break. At least you're focusing for 25 minutes. And if it's not your A1 project, that may be the most effective way for you to work if you cannot block out 90 minutes because of what you're doing. And face it, most people aren't going to call you at the beginning of 25 minutes or at the beginning of 90 minutes. It's somewhere halfway through on average. And it might just be a 2 minutes period that they have to wait. We got to get rid of the distractions. People otherwise, look, there's a distraction. There's always these distractions that come up and tear us down, and that's why the 90-minute marvel is essential. Distractions, interruptions steal our productivity. People interrupted make 50% more mistakes. Oh, gee, I left an E off there. Gosh. You will make more mistakes with interruptions because you will miss things. You will forget to follow up on things. People who are doing work, you think if they were going to protect kids in a school, they know how to spell school. Everybody is taught, don't get near an engine and a turbine engine when a plane is running. And they forget. Police get into accidents because they get distracted looking at their computers in their car instead of keeping their eyes on the road, just like everybody else. And there are even laws in the U.S. now that they're passing so people don't text and walk because they bump into each other. They step into holes and step into traffic. There's a lot of reasons to avoid this. On the one hand, people interrupted also take 50% longer to complete tasks. You make a plan. I'm going to do this on Monday, do this project, meet with my friend, do this, and then what happens by the end of the day? You know, everything gets set back, and we end up repeating the same work over and over and over again. You could literally not only double, but maybe 4 times as much productivity if you eliminated the interruptions. Distractions also cause injuries at the hospital, and one of the reasons we get hospital-acquired infections, HAIs. And in the US alone, they cost $10 billion a year, not to mention loss of life. So we need to find ways of getting rid of all these distractions that are destroying our productivity, all these interruptions to what we need to be doing. Now, stop treating all people the same. This is for managers out there. Lawyers love treating everybody the same because they say that's fair. But I think it is the most unfair thing you can ever do. Look around at your team or think of your team right now. Are they all the same? Or are some people harder working than others? Some people more cooperative than others? Some people have different personalities than others. If you treat them all the same, you're going to get about the same kind of performance from them you always have. On the other hand, if you start treating them differently, you can get quite a different response from them. For example, you ever have people with bad attitudes like this guy? Good morning. Prove it. Look at this. You get somebody like that. If you have a team you're working with, say, of 6 people, if you have one with a bad attitude, the one with a bad attitude can drag everybody else down by 20%. Agreed? If you got rid of the one with a bad attitude, you'd get the same amount of work done without having to deal with a person with a bad attitude. Interesting. Now, what if you got rid of that person with a bad attitude. Remember, they cost you 247% of salary. What if you took that 247% that was saved and put it into incentives for the last 5, the remaining 5? You might double what you're doing in your office. It's as simple as that. We need to be thinking of, don't treat everyone the same. If somebody's a problem, cut them loose. Give them an opportunity to change, work with them. I had one nurse over at NUH, National University Hospital here in Singapore. And she was patient. She was told, you got to cut this person loose. They're not any good. She stepped into this new department as the head nurse. And she met this person, thought they had potential, and worked with them. Worked with this one nurse over and over and over again. 1 month didn't change, 2 months, 3 months, 5 months didn't change, 8 months didn't change. She's got a lot more patience than I do. Finally, 13 months, this one nurse got it. It didn't become her number 1, but out of 20 became her number 3 nurse. Now that takes a lot of patience, a lot of investment. And if you've got somebody that's worth the time, effort, energy, who took 20% of her time, managerial time, go for it. On the other hand, if somebody you believe is not going to come around and you can't afford the time, give them some career guidance and get them into another firm where they may end up being happier than they are working on your team and dragging everybody else down. Intriguing, 74 to 80% of employees dislike what they do. They never saw a career. They look for a job, and one job gets replaced by another job. And if people aren't happy, you can't make people happy. You can't. Instead, you got to hire people that are happy. One of our clients, Hyatt, makes an effort to only hire people who smile 6 times in a job interview, because they said, look, it's hospitality industry. You can't train people to be happy. They have to come happy, and then we train them for skills. Hire for attitude, train for skills. Yeah, now, obviously, you need a you need a neurolateral brain surgeon. You can't just get a happy clown. You want to get the best. But if you've got 6 candidates that are similarly proficient, hire the one that's more willing to work cooperatively with others, is going to be friendlier in the operating theater, and get along better with your team. It's a matter of thinking through the process, what we need and how we're going to work with them. 1/3 of workers are either neutral or disappointed in their bosses. Do you think it's any different with your team? Yeah, probably not. You think about your people, 2/3 probably like you, but 1/3 are probably neutral or disappointed. It's just the way it is with people. Now, there are 3 groups that we work within. That 1/3 are the wieners. These are the people trying to get out of work. Boss around? No, let's go and have a smoke. You know? And then you got the whiners. Why is it always my job? How come I'm the one? And they're always complaining nonstop. And then you got the winners who just pitch in and do the work. Hey, get over there. Get out of there. Okay. Winners who just pitch in and do the work. Now, if you treat the winners the same way you do the whiners, or you're not going to get them motivated. And if you treat them like the wieners, they're going to leave you. The wieners trying to get out of work. Winners are trying to do the work. But the winners get pulled back because they work so hard and they see they're covering for the wieners who don't do the work. And then they slow down because why should I work so hard when the other ones get away with doing so little? You got to start thinking about how you treat your different thirds, and everybody's got thirds. Some people's bottom third are better than other people's top thirds. So you got to work with your people in different thirds and figure out, what do I need to do to work with them? So in addition to those with bad attitudes, am I working here with a wiener, a whiner, or a winner? And what I need to do is put different controls. The bottom third needs more controls. The top third better not have any controls. These are your race horses. Don't pull back on the reins for your race horses. Let them buck. Let them go out and do that. Here's an example, 1-minute video of bottom third.
Somebody! Hello! There are 2 people stuck on an escalator and we need help. Now, would somebody please do
Isn't that silly? They're stuck on an escalator. All they got to do is walk, and yet they're stuck. Well, bottom third workers are like that. They're stuck in their job. They won't come over and say, boss, you know, I'm done with my work now. Is there something else I can help you with? No, they'll find a way to sneak out and waste some time. Will they go and volunteer to see when they see somebody else in need? No, it's not my job. Drives me crazy. They won't step forward and do something productive. They wait until they're told what to do. We have to help them become proactive and productive by changing what we're doing. In my estimation, you look at the average hospital or clinic, 1/3 make us money, your top third, middle third about break even, and bottom third cost us in the average situation. How are we going to fix this? First of all, bottom third need short-term goals. If they don't have something to motivate them in the short term, they're not going to do it. Your top third can work on a 5-year plan. Middle third, 1-year plan. Bottom third needs something to do in the next 3 weeks, 6 weeks with a goal and a reward associated with it, and then you can get them to move forward. When they start moving forward, you're going to find not only that your top 2/3 are going to move forward as well. There need to be transparent systems. Your bottom third will hide in a non-transparent system. Put everybody's goals, including yours, out where it's visible on your social media page. They can see where you're at on your goals and your level of completion, and you can see theirs. When it's transparent, the bottom third stick out like a sore thumb, and they're either going to leave you, which is not a bad thing, or they're going to buck up and do their fair share. And also, if they're not doing their job, don't expect HR to fire your people. Come on, you got to motivate them, and you got to want to discipline them. So if you discipline them and they don't change, you write them up. You write them up a second time if they don't do it, and then you give them exit visas, because you can't afford to hang on to an expensive resource that's not pulling its weight. Well, that's all I had for today. Questions?
Okay, so we will now be starting our questions and answer segment. You can type in your questions in the chat box on the left side of the dashboard of your screen. Okay, so let's start with one of the questions that we received from Ms. Nguyen T. Tantao of ONI Saigon General Hospital in Vietnam. Her question is, how to motivate different health workers with their unique and diversity. Empathy is asked for patients we work for, but any way to share our empathy for our coworkers who we work with?
Okay, empathy is important with coworkers. And when I'm talking about your team in the bottom third, I'm not saying you have to let people go. It's only if they're not doing their job entirely. Some people are just going to be a little bit slower, and they have no interest in advancing, and that's okay too. Empathy is going to come from talking to them. You have a lunch with them. Most team building and bonding doesn't happen at work. It happens after work or in the lunch periods that we have. And so as you sit down and buy them a lunch and talk to them about what's going on in their lives, you find out, hey, I got a sick son, or my husband left me, or whatever issue it is, or you know, we're struggling with finances right now because of some problem that we had. You don't give them the money, by the way. That you're not a bank. You can help them by recommend, but don't lend them the money. But you need to have that empathy for them, and don't say I feel sorry for you. Just say, you know, we've all gone through tough times. I can't loan you money, but what can I do to help? And sometimes they just need an ear. Empathy for the situation. If they're having a particularly heavy load, or they've got some patients, for example, in nursing, they got some patients that require a lot more effort, and they've got the same number of patients as everybody else, even though they've got some that are a little bit tougher. Well, readjust, readjust the deployment, and maybe give them a little more time and fewer patients. It's a matter of seeing what they need your empathy with, and then try to help them get what they need. Zig Ziglar said something that I apply to management. He said it about sales, but it's true about everything. To get what you want, we have to help other people get what they want. To get what we want, we have to help other people get what they want. So it's helping them get what they want, making them feel more successful, feel more appreciated. And sometimes it's even just sitting down and listening to them is how we can gain empathy. With the whole team, same thing, having a sit down after work or sit down lunch where we share ideas, and maybe you buy the lunch and say, hey, I want you as much as possible to enjoy this and to take this time, and we'll work this through together. And if you go to lunches in different teams at different times, do the same thing with every team that goes to lunch.
Okay, thank you so much for that, Mr. Podolinsky. So we have another question. How do we balance the productivity strategies implemented, given that we have different staff in the office, in the hospital, and they have different work preferences?
Well, in terms of work preferences, finding out what they want to do and when they want to do it, it would be wonderful if you can have flexible hours. And in Singapore, only 34% of companies will employ flexible hours, even though probably 90% could. There are times that you're going to be busier and you need more people in, and you just say everybody must be here during these core hours. Others can come in earlier and get more work done when there are no interruptions, or stay later after most people have gone home and get more work done. So if you can be flexible with them and find out why they want to have a particular shift, or be able to come in early or come in a little bit later, and accommodate them, that would help out. Work preferences on jobs. Sometimes their job seems so tough and they wish they had somebody else's job. I think, and this is one of the things I learned from Japanese, rotate jobs through. And if people have different jobs, different requirements at work, it's more interesting for them. And sometimes they think everybody else has an easier job than them until they do their job. And pretty soon they think, wow, I'm glad I got my job. Mine's a lot easier than that one. So it might be, those might be a couple of thoughts to help you work through that. If that answer is great, and if not, maybe word it another way so I could better understand the question.
Okay, thank you so much for that. It seems like that's our last question for today. If anyone would have any more questions, please feel free to email us and we will forward your questions to Mr. Podolinsky. Any last word, Mr. Podolinsky, for today's session?
Productivity is value add, and that comes from a state of mind of always adding value. What's the most productive thing possible at any given moment? And if we can focus on that and get our teams to focus on that, it's amazing how much more we can do in an average day. Thank you for being part of this webinar.
So thank you for taking your time to join us in our webinar.
Pleasure.
We hope you enjoyed and picked up on many important points mentioned. We'd love for you to join us again in our future webinars, which you can find out from our website. You can visit www.hospitalmanagementation.com. Thank you again and have a good day ahead.